Some of the most common compulsive disorders in dogs are light and shadow chasing, blanket and flank sucking, tail chasing or spinning. It can be for hours on end that they chase their tails. So, I mean, these are literally, they're performing this behavior in lieu of other things, normal napping cycles, normal sleep cycles, eating, et cetera, et cetera. So it can be really, really intense. I've seen them destroy their tails to the point of where they grab it and actually have to have their tail amputated because they do so much damage. And in cats, it's wool sucking and pica. And so they will eat anything from plastic, hair ties, that's a really common one, I think, the hair bands, dirt from plants, plant leaves, that sort of thing. And there's actually more and more evidence that pica in cats, and there's a study coming out from the University of Montreal by one of my colleagues, that it's actually a primary GI disorder, and they might actually have underlying inflammatory bowel syndrome. And once we treat the IBS, then they will actually resolve the pica behavior. And so each of those disorders is very different in how they present and manifest. However, most of them occur at about sexual maturity, so 7 or 8 months in most dogs and cats, but that's not standard across the board. What happens is the animal is stressed, and so they use that as a coping mechanism initially, and then it becomes emancipated from the original stressor, and so then they perform it in other time frames and at other during other scenarios, and sometimes it can take over their lives so much that they don't do their normal behaviors like eating, drinking, sleeping, and so it really is a welfare issue.